Welcome, and today we are going to do a mock test. This is rather a practical test for you to identify parasites in stool samples. So I will be showing you certain structures which are the parasites, mostly in stool samples. Some may I have little deviations from time to time as well, but mostly I'm concentrating on parasites which are present in stool samples in this presentation. So this is the first slide for you to identify. Now for all the other slides also this is very common. Now when you try to identify a structure, you look at the shape of it first. And actually you need to look at the size of it as well, but unfortunately here I have not given you the dimensions, the size or ruler measurements, so you can't you can't decide on the size of it. But when you are looking it under the microscope in the lab, you have a sort of assessment of the size as well, which is very important in identifying the parasites. And once you have the assessment on the size and the shape, then you look at the morphological characteristics. Like first you look at the wall, whether it is a thin wall or whether there are any protuberances or whether there are several layers in the wall. Likewise, you look at the thickness, the appearance of the wall as well as the thickness. And then you go to the internal structures. Now these internal structures, one thing you have to look for is the nucleus, the structure of the nucleus, the appearance, and then if there are more than one nuclei, those how many nuclei are there, and when there are other appendages and other structures apart from the nuclei, you need to look at those as well. So based on all these things, the facts that I told you, you decide on what parasitic species is this. Okay, so with that, when you apply that knowledge onto this, try to identify what this is based on the shape of those sites. As I not given you the size, you can't decide on it, but the other structures. Okay, take about few minutes, at least half a minute to decide on it, and then try and see whether you can recognize what it is. So what I earlier showed was the Intestinalis coli cyst. Now Intestinalis coli cysts are round. Generally they are round, so that is one clue to recognize it as E. coli, Intestinalis coli. And then you look at the number of nuclei inside. Generally they have more than 4 nuclei. So what can go wrong is sometimes you may think of Intestinalis histolytica, but of course when you know the size, when you have the size measurements, the Intestinalis coli is larger than the Intestinalis histolytica. With that you can have a good guess as to this is pointing to Intestinalis coli rather than histolytica. The other thing is the number of nuclei. In histolytica it is less than 4 usually, and in Intestinalis coli it is generally more than 4. Generally you can see up to about 8 nuclei. And both have, even histolytica has chromatoid bars. If you see them, the appearance of the chromatoid bars are different in the two species, but these are not commonly seen when you look under a microscope, in a wet mount or iodine sphere. It may not be very much seen under the microscope. So moving on to the next one. Now try to identify what this structure is. This is again from a stool sample. This is a normal saline sphere. You can have a look at the shape and the internal structures. Based on that, try to identify what that is. So take few seconds more and try to see whether you can understand what it is. So this is the answer. This is Giardia intestinalis cyst. Now you could see there it is ovoid or kind of ellipsoid in shape, and generally it has 4 nuclei. You may not see all 4 nuclei, nuclei, but at least you can see the central axoneme in the middle. The nuclei are usually on either sides of the central axoneme, but at least you can see the shape and the size and the central axoneme. The size is important, but again, since I have not given you the size, you can't differentiate using the size. But when you are looking under the microscope, you can have a assessment on that as well. Moving on to the next one, this is another structure. Try to see the appearance, the structures, the appendages, the internal structures, and take about few seconds and try to see whether you can recognize what it is. Again, this is from stool samples, so this is a parasite present in fecal samples. This is again a normal saline wet mouth. So what was shown there was Valentinium coli trophozoite. Now you could see that around that structure there were cilia covering the entire structure, and that is the clue. Generally, Valentinium coli is the only ciliate causing intestinal infections in humans. It's only Valentinium coli is the only ciliate parasite causing intestinal infections in humans. So when you see cilia, that actually when the sample is from a human, it rather points to the Valentinium coli, even when you don't know the other structures. But you could see the cilia right around the structure, and then generally it has two nuclei, which are also seen. One nucleus is the macronucleus, the bigger one is bean shaped, and the small one is generally brownish shaped. And the cytostome is like a mouth opening for engulfing food. So that was Valentinium coli. So can you identify these structures? This is again from a fecal sample. The smear has been stained with modified Ziehl-Neelsen stain. Again, the size is quite important here, but again, I have not given the size, so you can't consider that factor here for recognition, but you can consider the other factors. So in the previous slide, I showed you Cryptosporidium species oocysts. Now you recognize them with the appearance of bright red or intense pink color of the oocyst, and then as you can see, the background is bluish or green in color, and usually we go by the size as well. Generally, if you put a measurement tool onto the microscope, you can see that it's about 4 to 6 micrometer in size. So this is the same thing shown again with a description where how you recognize them when the oocysts are stained with modified Ziehl-Neelsen stain. So now let's see another structure. Now this is of course not from a stool sample. This is from a urine sample. See whether you can recognize them. Now these are not present in Sri Lanka. In fact, if at all we see patients returning from Middle East or maybe from African side, these cases may be reported, but otherwise this disease is not prevalent in Sri Lanka. So what was shown to you was Schistosoma hematobium. The diagnostic or how you detect it is with the terminal spine. Now Schistosoma species are called blood flukes because they are in venous blood. Out of the schistosomes, hematobium is the only one which is present in urine. The other two are in the fecal samples. That's why I wanted to show schistosoma species X as well. But having said that, hematobium is not present in fecal matter. It is present in urine because all three species infect the adults live in the blood. That's why they are called blood flukes. The adults are found in different venous plexus related to the body. So hematobium is in the venous plexus close to the bladder, urinary bladder. So these eggs are found in the walls of the bladder, and it can actually cause bladder cancer as well. Diagnosis is by examination of urine to look for this hematobium eggs with the terminal spine. Now this slide is showing you a comparison of the schistosoma eggs. Out of the three, I told you schistosoma hematobium, which has a terminal spine, is found in urine, and the other two, schistosoma japonicum and schistosoma mansoni, are found in fecal samples as well. So japonicum has a lateral knob, and mansoni has a lateral spine. So with those knobs and the spines only, you differentiate each of the species of schistosoma. So this is another structure that may be found in fecal samples. This is quite straightforward and easy, and this is quite common in Sri Lanka as well. Just see whether you can recognize what this structure is. So this is the answer. What was shown to you is Ascaris lumbricoids egg. So it has the characteristic appearance. It has a thick wall, which has three layers. The outermost mammillated layer is quite well seen. The other layers are also seen. And then generally this egg is bile stained, yellowish or brownish in color. So that also gives you a clue. And inside, this is a fertilized Ascaris egg. So it has the embryo inside as well. In certain instances, the outermost layer, that's the mammillated, this knobs-like protuberance, that layer can get sloughed off. In that case, the characteristic fertile egg is called decorticated when the mammillated layer is not there. So such eggs are also found in feces. So you need to know how they look as well. So this is another egg found in this is a parasitic egg found in feces. So just see whether you can recognize it. Look at the shape, size, the color, the internal structures, thickness of the wall. Look at all those and see whether you could identify this. Now one thing which I didn't mention earlier was, in case if you are asked to, now we usually don't give you a practical test, but if you are given a practical test, what the identification means, you need to identify what is the genus of the parasite, and in certain instances you can even say which species that is. So genus and the species is a must. Of course, species you may not be able to say at certain instances, but at least the genus is a must. And then the other thing is, you need to say what is the stage of the parasite, whether it is a trophozoite, whether it's a cyst, whether it's an egg, or is it an adult. Likewise, you need to tell what the stage is. So identification means you're telling us what the genus or the structure is, and then what is the stage is. Okay, it could be a trophozoite, cyst, or egg, or proglotid, or something like that. So what was shown to you was an egg of fornicator. Rather, in general, we can call it hookworm eggs. And now, there you could have, I hope you noticed that it has a very thin wall, and it is oval in shape, and that the whole thing is colorless, the shell is colorless, and the ends are rounded, it's bluntly rounded, and it has a embryo which is divided into 8 cell stage. And if you see from the wall, that thin wall up to the embryo area is clear. That space between the wall and the embryo is quite clear. So those are the features with which you are going to say that this is a hookworm egg. Now when it comes to hookworms, you would have learned that there are two species that can cause hookworm infections, that is Giardia americanus and Ankylostoma duodenale. In Sri Lanka, we don't have Ankylostoma duodenale causing human infections as human hookworms. What we have is Giardia americanus. We do have Ankylostoma coming from animals, but that is not causing hookworm infection. That causes another different infection. Here, we don't expect you to say whether it is Giardia or Ankylostoma because you can't differentiate which is which using this structure. You only can say that it is a hookworm egg. So now let's see whether you can identify this structure. Again, look at since you can't differentiate the size because I haven't put you will have to use a graticule in the eyepiece, and you should have calibrated your microscope to say what size is the structure is. When you have that facility, you can use the size as well. Otherwise, here you're going to use the shape, the wall thickness, the color, the internal structures, etc. So what I showed you was a Ascaris lumbicoids decorticated egg. That means it's a fertilized egg where the outermost mammillated layer is sloughed off. Now, if you look at the two images that I have given you, first one is from a normal saline smear, the second one is from iodine smear. Whichever it is, I'm trying to show you that when the mammillated layer is sloughed off, it can be sort of entirely gone or partially gone, like the below picture. Okay, so decorticated eggs are also Ascaris lumbicoid eggs, fertilized eggs, where the mammillated layer is partially or completely gone. So this is one of the easy spot tests for students because it's quite easy to recognize this structure because there is no confusion with any other structure. This is again present in fecal material. This is again from a normal saline smear. You can see the shape, the shape and the other internal structures, which will help you to recognize it as which species it belongs. So what I shown you was Trichuris trichura egg, and you could see the paddy seed shaped egg, which was yellow brown because it's bile stained, and it has a thick cell wall, thick wall. You could see that the wall is smooth. There are no protuberance or mammillated kind of appearance. The wall is smooth, but it is very thick, and you could see that on either sides, at either corners, at the bipolar ends, there are plugs which are sort of clear plugs at the two ends. Okay, so with those you can recognize this as Trichuris trichura. Mind you, when you are writing Trichuris trichura, the spelling, the species spelling is not as same as genus spelling, so you need to understand there is a kind of extra I in the species. So this is another parasitic structure which can occasionally found in feces, uh, not very commonly found in feces. It can come to the fecal samples as well at times, but generally this is diagnosed, this is seen when you take a Scotch tape method. When you take a sample using the Scotch tape method, you could see these things under the microscope. At times it can also come to the stool samples as well. So that was Centrobius vermicularis egg. you could see the plane or convex shape. That means one side is flattened, the other side is convex. That means curved. One side is flattened, the other side is more or less curved, and it has the tadpole larvae inside, which may be seen or not, which you may not recognize. Or obviously you can see it, but the tadpole appearance may not be very obvious. And now the other thing is, you have to remember is, now when you compare this with the hookworm egg is also colorless, entropius egg is also colorless, but the hookworm eggs have a very thin shell, whereas here you can see that the shell is more thicker, and the shape of entropius is more plane or convex, whereas hookworm eggs are more ovoid with bluntly rounded hoop holes. This is another egg type which can come out in feces, which may be seen in the fecal samples. Just see whether you can recognize what it is. This is tinea egg. That means tinea solium and tinea saginata eggs. And you can't say whether it is saginata or solium, but these are cystode eggs, tinea solium or saginata eggs. These are round, and generally they have a radially striated wall, and inside you get the hexacanthic embryo, which has 6 hooks. And this is quite very much well seen, especially the spherical nature of the shape, and the radially striated wall is quite well seen. So this is another parasite present in fecal samples. Again, this is quite peculiar. It has a quite peculiar appearance, so that it's quite difficult to go wrong in identification. What was shown to you was Giardia duodenalis or Giardia intestinalis. It was earlier called Giardia lamblia. Now this is the Giardia duodenalis tropozoite. Okay, it has the pear shape. Some people call it the old man's face because it has a human face-like appearance. It has the 2 nuclei on either sides, which is look alike like a human eyes, and it has this central axostyle, which looks like the nose, and it has like hair on the human head. It has flagella, so it has of course 4 pairs of flagella. So with the shape, the number of nuclei, and the exostyle, and the presence of flagella, you can recognize it as Giardia duodenalis tropozoite. So that's all about the practical mock test. But similarly, you can go through the parasite present in blood, which will be taught you separate. Thank you.